Hello everyone, it's an honor to present you this research work on behalf of all the authors. First of all, I would like to thank the scientific committee for accepting our work and you for watching this video. My name is Cheryl Teres and I'm an EP fellow from Dr. Berreza's group at Teknon Heart Institute in Barcelona. My fellowship is sponsored by the Swiss Heart Rhythm Foundation, and as a disclosure I have to mention Dr. Berreza is a stockholder of ADAS 3D and Dr. Soto Iglesias is employed by Biosense Webster. Our work is entitled Feasibility, Safety and Efficacy of Tailoring Ablation Index to Left Atrial Wall Thickness During Atrial Fibrillation Ablation, the Ablate By-LAW study. This is the single center part. The aim of the study was to determine if adapting ablation index to atrial wall thickness is feasible, effective and safe. I'm not going into details concerning the left atrial wall thickness maps methods, but you can see a detailed description of the pipeline on our other presentation redo procedures. So all patients underwent MDCT from which we derived the wall thickness map, and then we obtain a categorized color code to create a range of thicknesses. You have the table there. Red is less than 1 millimeter, 4 is more than 4 millimeters. You also have the power settings for the posterior and anterior wall and the ablation index settings, and the VC tag is same as in closed protocol for the settings. So you can see the patient characteristics on table 1. This is average for paroxysmal AF, so I'm not commenting. And concerning the acute procedure characteristics, all procedures were performed under general anesthesia with high-frequency, low tidal volume ventilation and a single catheter approach. PV isolation was obtained on 100% of the veins with a median procedure time of 60 minutes, interquartile 50 to 69. Fluoroscopy time was less than 1 minute and a very low fluoroscopy dose area product. So for the right veins, we did 31 more or less 6 RF tags and RF time of 8 minutes and first pass isolation of 93%. This was pretty similar on the left. There were no complications and we had a mean ablation index of 365 on the anterior wall, 342 on the posterior wall. That is a mean reduction of 33% on the anterior and 27% on the posterior wall as compared to the closed protocol, with a mean RF time reduction of 50%. So the present study assessing a novel personalized protocol for radiofrequency titration during atrial fibrillation ablation shows a high rate of first pass isolation, a lower need of RF energy delivery, lower procedure requirements as compared to the previous PV ablation protocols, and further studies are needed to evaluate the long-term results of this approach. Actually, the multi-center study is already public in clinicaltrials.gov and will soon start recruiting. Thank you so much for your attention.